Hi, and welcome back to the American Society of the University of Haifa's weekly COVID-19 update with Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health. Be sure to tune in every Monday at 9 a.m. Eastern Time to hear Dr. Green's weekly update, and look out for our latest briefings that we've been hosting with various professors at the university across a range of different fields, all live here on our Facebook page. Thank you for tuning in, and over to you, Dr. Green.
Thanks very much, James, and thanks to all of you to start. I've been debating with myself as to what part of the update I should give you today, because there are obviously a number of topics that we are now talking about as the pandemic progresses. So I'm really going to be talking again, repeating where we are, and then try and look at some aspects of this lockdown and when we think we can open it up and how effective we think it actually has been. So again, the same questions of what is happening and where are we going, and just again to see that we've gone from 1.3 million to about 1.8 million since last week, and from 70,000 to about 110,000 deaths. And these are just reported, so there are obviously a lot more. So we're up 40% in cases and 60% in deaths in 1 week. And the case fatality rates remain very much high in the elderly and people with have underlying health conditions. I just want to show you a very quickly a diagram here from the European region to see what's happening in the European region. It kind of looks like a complicated graph, but it's really the proportion of daily cases in 10 of the top countries, the most effective countries in Europe. And if you look at the blue, that's Italy. So if you follow that blue, you'll see it's declining as you go from left to right. And then if you see what's happening in the red, that's Spain, which is actually going up. And then if you look just above it to the yellow there, that's Germany. That's starting now to kind of increase or stay high. The next is France, which is in green. And then you can see the UK, which is still expanding. And above that, a very interesting phenomenon that you'll see, it's kind of like an orange color with some green on, but that's that orange, that's Turkey. And Turkey now is experiencing a very large increase in cases. So what we're seeing is the pandemic spreading over the world. So what I want to do now is just look at the lockdown and the whole issue of actually what kind of interventions we should use and what we have used. And I'm going to take an example, which maybe you may say is a little bit extreme, but let's look at what happened in New York State, and particularly New York City and Israel. New York State has about 20 million people, I guess, and Israel about 10 million or 10 million. So we're about half the size in population to New York State. And in New York State, there have been nearly 190,000 cases and nearly 9,500 deaths. And in Israel, about 11,000 cases and 100 deaths. So New York State has about double the population of Israel, and it has 18 times as many cases and 95 times as many deaths. So we really ask ourselves why. Partly it is because New York State has a much older population, about 20% over age of 65, compared with Israel, it's about 11%. But also I guess mainly because Israel introduced the travel restrictions and social isolation much earlier. So let me just look at a couple of statements here. On March the 2nd, and I know it's often unfair to quote somebody who maybe in retrospect felt they shouldn't have said it, but he did tweet that people should ignore the virus and go on with your own lives and get out on town despite the coronavirus. Prior to that, in other words, the month before, Israel had already advised against non-essential travel to China, suspended all flights from China. In February, they extended the ban to include many other countries. And on February the 26th, Israel actually issued a travel warning to Italy and urged canceling of all travel abroad. So you can see that Israel there had taken a very strong stand. Whereas in New York, they were still debating. And on March the 3rd, there was a comment there, we are encouraging New Yorkers to go about their everyday lives. There is no indication that being in a car, being in the subways with someone who is potentially sick is a risk factor. So this was actually an evidence. And then on March the 9th, Israel declared a mandatory quarantine for all people entering Israel, requiring all entrants to quarantine themselves for 14 days upon entry. So you can see that the steps taken in Israel were much more extreme. I grant also a much smaller country, much more centralized in terms of governance. So it may well be easier to do it here. But there was a feeling that it was taken somewhat more seriously in Israel than it was in some other parts, like in the New York. So it appears that the early and relatively heavy-handed intervention policy in Israel was successful. So we've actually maintained a fairly, shall we say, low level of our case count and also of the deaths as it follows the case count. So what's happening now is we still have a very strict lockdown. We're actually expected to be no more than 100 meters from our house, other than traveling to buy food and so on. We need to wear masks at all time when we leave the house. And that's actually compulsory in Israel. I guess that in the US, it's difficult to make something like that compulsory. So there is a discussion about masks, and I won't go too much into that. I think next week or the week after, we'll discuss that again. But there was an item in Fortune that said why the US is changing its mind on coronavirus face masks. And Dr. Anthony Fauci actually said it's because of some recent evidence that the virus can actually be spread even when just people speak. So if you can't maintain that 6-foot distance, wear some kind of facial covering. So this is a change in policy. And it's an interesting one because initially we really didn't speak about the public using masks. So what lies ahead? Well, again, we're trying to keep the flattening of the curve. So we think we're succeeding in Israel. We were staying well below that level, that line, which our health system is coping very well with the burden of this disease. There are many patients, but it's not overburdening our system. The current plan in Israel is to keep this lockdown in place until we control the number of new cases. And in technical terms, to reduce the R0, and everyone's becoming familiar with this technical term R0. It's a little bit complicated to actually compute, but it really means the number of people that one person might infect. And if you think of it intuitively, if that goes below 1, then in fact the epidemic will eventually end. So we're keeping it at the moment very low. And the idea is to try and keep it very close to 1 in the future and gradually lift the lockdown and monitor that R0. So we're keeping it to a manageable level. That's the current policy, which is a lockdown. We're going to probably be increasing the role of testing for antibodies when we start unlocking, and that's I'll talk about next week. We later will also be talking about the use of immune globulin because we are now, like everywhere else, we're starting to take immune globulin, which is plasma from people who have been sick, and that may be used either for treatment or for prevention, a very interesting possibility, by the way, which will certainly, I think, in the future be something we could use to control the epidemic, or at least to manage the epidemic. And of course, continuing to research on treatment and vaccines. So the strategy now is really a slow return to work, and I mentioned it before. Intermittent lockdowns is probably what's going to happen. We'll go back to work, we'll see how things go, and if that R0 goes up too high, in other words, there are too many cases, we may lock down again. And just make sure that we're not overburdening the system. We may have different regional strategies, or there would be certainly in different parts of the world. And one example is, I mentioned shift work, that some people work 1 week, others the other week. And the other is obviously this challenge to protect the elderly and the chronically ill. And then I'll just make one comment on that, and we may be able to talk about it at a later stage. It's easy to say keep the elderly and the chronically ill separate from the rest of the population, but that has quite a heavy price to pay. Not only is it very difficult to do, but it actually increases this whole concept of loneliness and isolation, which in itself has serious health effects. So we need to think about that. Thanks very much. That's it.